On special segment tonight, the special trials of children of alcoholics, grown-up children who, even with the passage of many years, cannot completely heal the wounds of growing up with parents who drink too much. A book dealing with these problems has been on the bestseller list for more than 5 months now. And as Robin Young reports tonight, it has brought together so many adult children of alcoholics.
I remember the day that I realized that there was someone else like me. I was with a friend who was reading a book about adult children of alcoholics, and I picked it up and I sort of thumbed through it, and I couldn't believe what I was reading. I immediately went out and bought a copy.
Well, we put it in the window, and since we put it in the window, we sell hundreds of them. You have to reorder them as soon as we get them.
And it was tough getting through the first 4 or 5 pages. It took me about 2 days because it was so painful. It was wonderful at the same time because I realized that there is a reason, there is an answer for the way I am.
Kim was an overachiever with no self-confidence. Maureen suffered severe eating disorders. This woman was once dependent on tranquilizers. All read the same book, all sought help at one of 4,000 support groups for adult children of alcohol.
They felt sad forever. You know, how long have you felt sad? As long as I can remember.
Author Janet Woititz, a doctor of education with a practice in family counseling, says in her bestseller that parents who drink too much put their children on an emotional roller coaster, loving one day, cold the next. The children learn to deny the family alcoholism and its side effects until, as adults, that becomes unbearable. How sick can someone get because they grew up in an alcoholic environment?
Dead, I guess. It's as sick as you can get.
Suicide?
Absolutely.
And if I was the perfect little boy, somehow I was going to make my father well. And when it didn't happen, and my father wasn't getting well and the family was getting sicker, at that point I would look at myself and think, there's something wrong with me. I should have been able, as a little 7-year-old kid, to be able to fix everything. And I carried that into my adult life.
The groups follow the principles of Alcoholics Anonymous and use guidelines written by Dr. Woititz. Members may not have a drinking problem. Instead, they replace their parents' alcoholism with their own compulsive behavior. For instance, they become workaholics.
They will also be attracted to what they understand as love. And what they understand is love is someone who is warm and loving one day and rejecting the next. Those are the people who hook them in. Many adult children have been called possessive. It has been said that they do not take lovers, they take hostages. This comes from a fear of abandonment.
A Rutgers University workshop in alcohol studies features a lecture by Woititz that's aimed at healthcare professionals. She says they've lagged behind in alcohol studies because so many healthcare workers are themselves children of alcoholics. This doctor agrees he misdiagnosed patients because he didn't want to see alcohol-related problems in them that he didn't want to see in himself. And all of these doctors and social workers agree that they're trying to fix people today because as children they failed to fix an alcoholic parent.
When my grandfather would get drunk, I felt very responsible for all those little reasons. I didn't do this, I didn't do that right. What could I have done right?
Do you think you're becoming a doctor?
Oh, I think it had a lot to do. Oh, yeah, gosh.
Since part of the problem is denying that there is a problem, part of the solution is acknowledging it, which is why Woititz encourages everyone at the workshop to try to remember being a child.
And look at that child and see that child for what that child really looked like, what that child really felt, how that child could not in any way be responsible for what happened in that household. Some can't, some are still angry, but many of them are able to begin to love that child.
Those who come to that realization feel relief for the first time, knowing that they can work to change their behavior. And Woititz says that's doubly important because adult children of alcohol, whether or not they drink, can pass their compulsive behavior on to their children. Recognizing that behavior is the only way to end that alcoholic legacy. Robin Young, NBC News, New Jersey.
That's nightly news for this Thursday night. I'm Tom Brokaw. I'll see you tomorrow night.
are the child of an alcoholic parent. You may grow up and leave home, but you don't leave the problem behind. With us to discuss that problem are Janet Woititz, author of the book Adult Children of Alcoholics and Struggle for Intimacy, which we don't have with us today, and Ann Pacifico and Nick Fasolina, whose fathers were both alcoholics. Good morning to all of you.
Good morning.
Thank you for joining us. Janet, tell us a little bit about what ACOA, Adult Children of Alcoholics, is. You say it's a very distinct support group.
Yeah, it's amazing. It's people who grew up in homes where there was at least one alcoholic parent. And we're finding now that many other dysfunctional families also identify with the things that we see in this group.
It's interesting, when I mention dysfunctional families to people, they go, ooh, what is that? Could you describe what a typical dysfunctional family is?
Well, of course, first of all, there's no such thing as a typical dysfunctional family, but we can certainly talk about it. What it means is it's a place where a child gets his or her needs met inconsistently. Inconsistently. Warm and loving 1 minute and rejecting the next. A place where a child does not grow up valuing themselves as a human being, as a boy, as a girl. A place where they end up being concerned and worried about their parents, as opposed to those of us who spend our lives worrying about our children.
So the roles are reversed a lot.
A lot of role reversals. Lack of sense of who they are. Who they are and
children.
The children. And of course, what happens as children, we internalize.
Yes.
So as adults, even though we leave home, we carry all of those self-feelings and self-concerns and self-wonderments and self-shames with us.
Even in the workplace, you've also written Home Away from Home,
right,
which is a stunning book about how we carry our problems with us. Both of you tell us a little bit about what your childhoods were like.
Well, I grew up with two brothers and my mom and dad, and when I was growing up, I developed a very active fantasy life. I was going to rescue my dad from this bottle, and he was going to become Cary Grant, and I'd be his little girl, and things would be wonderful. Well, it doesn't work that way. When I was a teenager and his disease was progressing, his disease, since it's a disease of isolation, he would be buried beneath a book, reading, and there wasn't much communication at all. And happily enough, my dad is now in recovery a year, and I have my father back.
But you joined ACOA before that happened, right?
Yes.
Now, what is the difference between Al-Anon, Alateen, which are also support groups, and ACOA? What is the difference?
ACOA was designed for adults. Al-Anon is designed for someone who is living with an active problem.
The spouses.
The spouses primarily, or other family members. And the programs are all consistent. So at first you learn how to detach from the illness, because there's a lot of confusion. This is not your father. This is a disease, and it needs to be separated out. And that's something that Al-Anon does wonderfully well. Having done that, in the adult children's group, you can then begin to focus on yourself and make changes in your life if you choose to.
Tell us a little bit about your story.
I grew up in an alcoholic home, and there was a lot of confusion. I could identify with a lot of the things that Janet's describing. And in my childhood, I never knew it was okay to have needs. If I was hurting or if I was lonely, I could never say to someone, I need a hug, you know, or ask for help, or can you help meet my needs? In my family environment that I grew up in, everything was quiet. There was no feelings or emotions shared, especially sadness or grief. These emotions were repressed, and it took a lot of treatment in ACOA, and you know, getting the focus back on myself and getting in touch with who I was, because I myself had no identity. I didn't know who I was.
In Struggle for Intimacy, Janet, you talk about the myths of alcoholic children and the realities when they hit life. What are a couple of those myths that are so, I mean, for example, trust. Do we learn how to trust? Do we learn how to be intimate with other people?
Well, the reality is if you grow up in this kind of family, you know what you don't want. Knowing what you don't want...
That doesn't save you any, because you can still marry what you don't want.
But you don't know what you do want. It doesn't teach you what you do want.
I see.
The fact that I don't want to be angry all the time and I don't want to repress my feelings doesn't teach me how to express them to another human being.
But do you even know that you're angry?
Sometimes you don't. Your body knows. So we see a lot of people who will have a lot of symptoms, physical symptoms.
Tell us about that, because what are some of the compulsions that can attack, in a sense? We can all be victims of our own compulsions if we're living in a household where people are acting out compulsively. Have you both experienced that?
Yes, I have. As a matter of fact, in my 30s, I developed an eating disorder. Many alcoholic women, daughters of alcoholics, develop eating disorders, and there are many theories as to why that is so.
What are one of the theories that
well, one would be incest. That's one theory. There are so many. But for me personally, the eating disorder manifested itself in my 30s, as I said, and it was stuffing my feelings. Just those feelings would come up and I would stuff them down. Using food as a drug is how it affected me. You know, our Mayor Koch in New York, he loves to eat and he has to drop a few pounds. That's not what I'm talking about. What I'm talking about is anorexia, bulimia, and overweight, which are life-threatening. So the main thing is to recognize an interference in using food and to address that with groups, with self-help groups. The thing that makes you sick, an oral thing can make you well by talking about it.
We're as sick as our secrets.
That's right.
It's also true that a lot of this is sugar addiction, which is the basis.
Genetic, too.
Absolutely. So we must be aware of the fact that there are chemical components for children of alcoholics which complicate the other addictions. We know now that there's a real adrenaline high for those who become compulsive gamblers.
As quickly as you can, what would your advice be to the people that are out there saying, gee, that sounds like me?
To be aware of the fact that the self-feelings that they have and the behaviors are not their fault, that they were set up to feel and believe this way, and to begin to learn about it, to learn how their history set them up this way, and look toward these self-help groups.
That they don't have to take it out on themselves. They can
Exactly. Exactly.
Thank you all for joining us, and for those of you out there, if you want some more information on this important subject, you can write to the National Adult Children of Alcoholics, 31706 Coast Highway, Suite 201, South Laguna, California, 92677. Or you can call 1-714-499-3889. Do. Thank you for joining us.
Thank you.